Welcome everyone once again. This is the first lecture on monitoring and evaluation of health programs, stroke nutrition programs. So we shall have a series of lectures today on this module. So let us first understand what health programs are. We have health programs that are aimed at improving population health outcomes. We want to have a healthy population. So we implement health programs to address health problems that people are facing. So you can have a maternal health program. You can have a nutrition program. It can be a mental health program. It can be a community health promotion program. So these are basically sustained efforts to improve health outcomes in a given population with a given problem. So there should be a problem that is being addressed. So under the health programs, we have a number of, we can say projects. Programs are bigger than projects, okay? So under that, you have a lot of activities going on. The activities can be those that render services. They can be those that produce certain products, okay? So there are a lot of activities happening within programs. But basically, the aim is to make sure that people are having optimal health and diseases are being prevented. And generally, if people need health services, they can receive them. So within health programs, the number of activities, like I've said, before a program is instituted, it has to be planned very well. So we have program planning, where we assess the needs of the population. Okay, what are the challenges that the population is facing? What are the health needs, or what are the nutritional needs? And then the objectives of the program are written or set, and then how to address the needs that we have identified. And then now the activities to be undertaken in order to either increase service delivery, health promotion, nutrition promotion, capacity building, whatever they are. We also basically implement all those activities in the implementation component. And then you want to see if the program is actually moving on well. So you have what we call monitoring and evaluation. You assess the effectiveness, the progress of these programs that you have. You also continuously have what you call collaborative, you have the collaboration component. You want to make sure that every person or the key stakeholders or the community members are fully involved in the planning, implementation, and evaluation, and even closure of the health programs. So these stakeholders can be community members, can be the direct beneficiaries, those who will be providing the services, policy makers. Okay, these are important stakeholders that need to be involved in the health programs. So like you noted above, that we have an element of monitoring and evaluation, which is basically the focus of this module. How do we conduct monitoring and evaluation? Why should we do it? What are the principles that govern it? What are the ethical principles? And what are the contemporary practices? These are questions that we shall address throughout the module. So monitoring as a concept is, it refers to the ongoing and systematic tracking of program activities, inputs, processes, and outputs to ensure that they are implemented as planned. It involves regularly collecting data, analyzing it, and reporting it to assess the performance of the program, identify any gaps, and make changes when needed. Okay, so the key things here are that within a program, we have what we call inputs. What are those things that you need to have in place for the program to go ahead? Okay, so if, for example, you are implementing a school feeding program, that means that you need the different types, for the inputs, you need the different types of foods, the different varieties. You need the human resource, okay? You need the money, okay? You need different resources that, for example, if the plates, how the food will be delivered, and all the things. So definitely the things that, or the resources that you need in order to start implementing the project or the program are the ones we call the inputs. And then the processes, what are how will things be flowing? Those are the processes. And then the outputs, and is it the service or is it the product? Okay, what is the output of the given program? So you want to make sure that you track everything that is happening, the activities, the inputs, and the processes, and then the outputs, to make sure that things are actually being implemented according to the plan. So it is an ongoing process. That means that you start the program today, you start collecting data today. Going forward, you keep collecting that data to identify any gaps, and then you make corrections if things are not going right. So you make sure that resources are actually used effectively and that you are actually moving in the right direction. Evaluation. Evaluation is concerned with systematically and objectively assessing the health program's design, implementation, and outcomes. For it, it goes beyond looking at what is happening on a daily basis. It looks at effectiveness, efficiency, relevance, sustainability, and the impact of the health programs. Okay, so this is actually more broader, if you can use that word. It is actually more broader. It looks at a lot of aspects. It does not only look at how the program is being evaluated, being implemented on a daily basis, but it focuses a lot on the overall implementation of the program and how it is, whether it actually meets or it actually met the goals or the objectives for which it was actually implemented. So we look at impact, sustainability, relevance, and then effectiveness and efficiency. So evaluations use a variety of methods to collect this information that we can use to assess the extent to which the program has achieved its intended goals. So evaluations can be done during the implementation of the program. So we can call those midterm evaluations. Okay, the program is for 1 year, then after 6 months, evaluations can be done, or they can be done after the end of the project, summative evaluation, okay? Or they can be done several years after the project ended, okay? So those are the key differences that it has with monitoring. Monitoring is looking at how are things being done now, and what are the gaps, and how can we adjust. Evaluation looks at what did the program achieve, what was the design, the implementation, the efficiency, effectiveness, okay, relevance, sustainability, impact. Those are the things that evaluation looks at. So this evaluation actually helps us to still evaluate and to still decide on the areas that need improvement. It can also help us in informing policies. Okay, data that we get from evaluation can be very important in adjusting policies, resource allocation, and also for other programs that we can plan in the near future. So those are the benefits of evaluations. Evaluations are very, very important in this generation that we are in. Why? Because donors want the evaluations to be done. Okay, so it is a donor requirement. And then most of the things that are actually being done are project-based. Most of the work that is being done is project-based. Even us here at Restore, we have projects. I don't know if you're aware of any projects that we are running at the moment. Who can tell us one? One example of a project that Restore University is running.
Yeah, we have this education project.
Which one? Which one is that?
Education.
Education project.
Yes.
Okay. We can call that the current one, where we are actually teaching you. We cannot call that a project. We can actually call this is a continuing activity. We shall always be teaching and teaching and teaching. But if, for example, we go and teach other people outside, for example, an organization comes to us and they want us to build capacity of their staff, then that becomes a project, because we shall have a time frame for it and say, okay, we are going to train you for 1 month. That becomes a project. Developing the app becomes a project because we set time frames. The difference, one of the major differences between a project and a program is that a project has a time frame. The activities have to be undertaken during a given period of time, and then they stop. So most of the works that organizations have are project-based work. Okay, they are activities that are project-based. Okay, so we are having more and more organizations tending towards having project-based work than actually having some activities as part of their mainstream programs. And then also monitoring and evaluation is becoming a recognized field, a highly recognized field, very competitive, very profitable, and also the market outlook is actually very good. And there are also professional bodies coming up in monitoring and evaluation. So that means that a career in monitoring and evaluation can be very fruitful. even though in our country, the profession has not actually grown, just like most of the professions that we have. The mainstream professions, for example, that are vibrant in other countries are not yet vibrant here. Medicine and surgery, pharmacy, dental surgery, nursing and midwifery, engineering, IT. These are what we call mainstream career options that anyone who wants to enter into a given career can actually choose amongst those very easily. But still in our country, they're not yet. So then now coming to these programs like M&E, we have not yet developed to reach an extent of having professional bodies in M&E, for example. In South Sudan, that is, we are not yet there. Hopefully with time we shall reach that extent. So who will get involved in evaluations? If you implement any program, any project, definitely you're going to be involved in M&E. Sometimes you may not necessarily have a written M&E plan, but that does not mean that actually you're not doing M&E. Okay, everyone is every person is involved in one way or the other in M&E. Okay, as long as you're working, you're in one way or the other involved in M&E. For example, if you're working, you could be a secretary of a meeting, and then you're writing down the minutes of the meeting. Those minutes are also very important tools for collection of data in monitoring and evaluation. You can be a clinician, a doctor, a CO, a midwife. When a patient comes, you write down their particulars. You're basically collecting information, and that information is actually also very useful in M&E. So virtually anyone within an organization is actually being involved in M&E. And that's why when you want to have a very sustainable, efficient M&E systems, you need to involve everyone. Everyone within the organization needs to know what has to be done or what their role is. Organizations may hire an M&E officer who continuously carries out the M&E activities, but of course with the help of the other members in the organization. So when we do that, that is what that person is an internal evaluator. When we hire another person to come and evaluate the activities or the program that we are implementing, those are the ones we call external evaluators. There are also unique advantages and disadvantages of having internal evaluators. So that's something that you really need to think about when making a decision on who is going to carry out or who is going to lead the M&E efforts. Those are important questions to answer. M&E is governed by standards that are agreed upon to assess the effectiveness of health or nutrition programs. So we are going to look at these standards and what they really mean, okay? What we have understood is that these evaluation standards help us in conducting quality and effective evaluations These are standards that everyone has to follow. So here we have 5 standards: utility, feasibility, accuracy, accountability, and then proprietary. So we are going to look at each of these and what they really mean. Utility. Utility basically means that there should be benefit derived from a good or a service. That is the meaning of utility. So utility in evaluation, that the evaluation should bring a benefit. You don't need to carry out an evaluation and use resources, yet it will not benefit the stakeholders or the intended users of the evaluations. Okay, so that is the first standard, which is utility, that the evaluations have to meet the needs of the stakeholders. It should not be done just for the sake of doing it and then misusing the resources just for doing a feasibility that, an evaluation that will not be used in any way. The second standard is feasibility. Is it something that you can do given the resources that you have? Okay, and the time constraints. You may want to do an evaluation and you don't have resources. If you don't have enough resources, don't do an evaluation. Don't do an evaluation that will stop along the way because you don't have enough resources, or that you have been caught up by time. So look at the cost and the time constraints associated with the evaluations. The evaluation should be done in the most appropriate way in terms of making sure that the ethical standards are met. You're not harming anyone. You're respecting people's rights, confidentiality, privacy, informed consent. All these things should be ensured. Therefore, evaluation should be done in a transparent and accountable manner. Okay, the evaluator should also demonstrate integrity. This one comes to the issue of people who hook up data. They're not actually implementing the programs, but they are sitting under the mango tree and say, we have served this number of people, we have distributed this number of mosquito nets. That is not doing work with the integrity. And if you're doing that, or if you are an external evaluator and then you're called to do an evaluation, you reach on ground, no activities have been implemented, but in your report for evaluation, you say, the activities have been excellently implemented. This number of people have been served. This number of people have been reached with a message about a given program. That is not appropriate. The data should be accurate. This is related to what I've just explained, that don't cook up information. Okay, use the appropriate tools to collect data and then appropriately analyze it and make valid conclusions from the data that you have. Okay, accuracy is very important. Another element is, of course, you should demonstrate your competence by deciding the appropriate way to design an evaluation program. Okay, you have different questions, different evaluation questions that you have to answer. We implement a number of programs. They can be breastfeeding programs, they can be a prevention of malaria programs, whatever programs they are. They have their evaluations are actually different. So you need to choose the appropriate evaluation design that matches the evaluation questions that you have. This is almost related to what we have in research. In the usual research that we do, that you have a research question. That research question has to be answered by the appropriate research design. Are you going to conduct an observational study or an experimental study? Okay, so this has to be very appropriate. Decide on the appropriate evaluation design. Accuracy is also related to this, which I included here. You are now relating integrity to accuracy, to transparency and reporting standards. You see, these things are actually related. If you are professional enough, you're going to do the right thing. If you are not, you're going to cook up data, and then you have inaccurate data. And then that means that you're going to influence how this information is going to be communicated to the stakeholders. There will be certain information that you want to hide from the stakeholders about your evaluations. So you see that integrity is related to accuracy and also transparency. So these are very, very important. What is expected of you as a professional is that if there are limitations to do with your evaluations, you should communicate that the limitations or biases or uncertainty. And you can actually say that this issue may need to be studied further. And that is what a professional does. So basically, in general, if you're going to do an evaluation, you need to understand who are the people that you're going to seek information from, and you start engaging them. That is stakeholder engagement. Okay? Depending on the context, whether this evaluation is an internal or an external evaluation, that you need to describe the nature of the program that you're going to evaluate, and then discuss the evaluation design, and then gather the information that you actually want, make the needed conclusions, okay, valid conclusions, and then share these with the relevant individuals. And then the circle continues in the evaluation process. As an evaluator, you will carry a number of hats. That means that you do a lot of things at a go. You need to notify people that things are not going right and you need to change. And then you spearhead that change process. You know, change is not an easy thing. If you remember what we looked at in change management, I think last week. Okay, and then you have to teach them how to do the right thing. But you yourself also has to be a person who learns. The data that you collect teaches you how things are supposed to be done. So you need to be a learner, and then also work with the different people. So you need to be a person who collaborates with other people. So these are that means that as an evaluator, you need to be very dynamic. You don't need to be very static. A person who is not easy to work with. You need to be a sociable person, a collaborator, and a person who also is willing to learn. So basically, this is how an evaluation happens. The process is cyclic and interdependent. If you don't design the appropriate way to do an evaluation, you will have problems in how the data will be collected, analyzed, and also you will get issues communicating this evaluation findings to your stakeholders. Yet, you actually want to have the program put on the straight path. So you get a lot of issues. So each step should be planned appropriately. Okay, this is basically emphasizing the same point that each step is interconnected. If you don't do things in the right way, you will get problems along the way, whether data collection, design, analysis, and also writing and communicating the different conclusions or your final report. Engage the key stakeholders. These ones we have already talked about them. The people who have interest in a given project are the stakeholders, the donors, the policy makers, the government, beneficiaries, the people who will approach the host community where that project is being held. So we have different types of evaluations that we can carry out. One, community health assessments. You basically collect information about health problems from a given community and understand the prevalence, the mortalities, and other things. And then process evaluation. To what degree has a given program been implemented in accordance with the plan? Is the program being implemented as planned, or something is not going on well, or something did not happen as it's supposed to be? And then effect evaluations. Did the program create any difference? If it is a nutrition program among children under 5, did malnutrition drop within that population? Cost evaluation is another issue. It focuses on whether resources were used efficiently in a given health program. Sometimes you may want to do an analysis that is actually comprehensive. Okay, then you do what we call comprehensive evaluations, where you look at the assessment data, process evaluation data, effect evaluation data, and then cost evaluation data. Okay, so all those different types of evaluation, you carry them at the same time on the same program. That is a comprehensive evaluation. And then a meta-evaluation is when you look at findings from other programs about the same problem that is being addressed by the same program. So such that you can make conclusions on these programs. And then summative evaluation, these ones are done at the end of the program to see if actually it had an impact. Sometimes we can call this outcome or impact evaluations. And then you have what you call formative. These are the ones that are actually called midterm evaluations. As the program has been implemented, shortly after that, evaluations are done. That's what we call formative evaluations. Health evaluations or evaluations in general have been changing. They have been dynamic. The principles have been changing. So every evaluation that we have, whether it is evaluation in health or nutrition, whatever it is, all the evaluations emanated from the health sector. So the health sector evaluations previously focused on student assessments, but these days evaluations have dramatically changed. As you can see here, the focus is more holistic than in the 1960s and the 1980s. Initially, the focus was inputs, activities, and outputs. But then in the second generation, the focus was more on impact, logical frameworks. The current or the contemporary evaluations focus on using technology in M&E. And because of technology now, we have capabilities of doing what you call real-time monitoring. And this means that we are able to collect data in real time on a daily basis. And involving every stakeholder is very important, that is participatory. And then result-based monitoring and evaluation is also another contemporary practice that we have, that the program activities should be linked to the desired results using the indicators to measure progress. You don't just implement a project without tracking the impact or the results, the immediate results of the program. Using data visualization and reporting to communicate data very well to different stakeholders, it means that you need to be able to communicate complex information in an easy way. So you need to use charts, the graphs, infographics to enhance understanding of the data. That is very, very important. Carry out an evaluation that you actually will use the data for. Okay, the findings should be useful. Don't do an evaluation where the findings are not useful. That is fine. And then impact evaluation, looking at the long-term impact of health programs is very key and something that is being done. So we have come to the end of the first presentation. We are going to have the second one at exactly 4.